Welcome, everybody. Thank you for joining us for our next MDisability Provider webinar series. So this topic is going to be on medical education accessibility overview for students and trainees with a disability. We will also try to learn about some of these ideas, strategies, and try to implement them in a healthcare setting. Many of the approaches I think, are going to be very relevant, as we'll hear from Dr. Vogler, and I will also add some information at the end. So again, this is a Department of Family Medicine at University of Michigan, and is a part of our provider webinar series, which is intended to educate our audience on strategies to make our healthcare more inclusive, especially in primary care settings. So with that, I want to introduce my colleague and my friend, Dr. Christian Vogler. He's the Director of Technology Access Program at Gallaudet University. In addition to his role as Director of Technology Access Program, Dr. Vogler is a principal investigator within the Rehabilitation Engineering Research Center, and he is focused on telecommunication access. He is interested in accessibility of web conferencing, telecollaboration systems. In his role with this project, he is involved in bringing consumers and industry together and really try to tackle many of the accessibility issues that we see. He is also working on a number of prototype technologies for improving the accessibility of such systems. Prior to joining the Technology Access Program in 2011, Dr. Vogler worked on various research projects that were related to sign language recognition and facial expression recognition from video at University of Pennsylvania, Gallaudet Research Institute, Unicamp at Campinas, Brazil, and the Institute for Language and Speech Processing in Athens, Greece. He also runs the Deaf Academics mailing list, a global network of deaf and hard of hearing researchers all over the world. So we're looking forward to hearing from him. Before we move forward, my name is Mike McKee. I'm an associate professor here at the Department of Family Medicine, and I am also co-directing the Center for Disability Health and Wellness at University of Michigan with Dr. Michelle Mead, and also direct the MDisability program here at our Department of Family Medicine. And just for full disclosure, I am bilaterally deaf, and wear a cochlear implant on my right side. I'm sitting in my office. I have a black short sleeve shirt and wearing glasses, and a middle-aged white male. And so I will be sharing a little bit information about my passion, which is about improving access for healthcare, especially in the primary care settings for people with disabilities. So we have a few acknowledgements. So first of all, the University of Michigan Health Interpreter Services Program, we are really thankful both for James Scheck, Christine Saunders to join us here today and to provide access and interpretation for today's presentation. We also have screen line captioning, and Phelps is providing the captioning, so if you need to turn that on, if you go down, there'll be a CC button and you can activate that. We also want to thank Dr. Robert Fisher, Family Medicine Fund, for his support to provide support for our access costs and also for any presentation related fees. So, and then lastly, but not least, I want to also thank the HEAD DC RRTC, which is a grant through the National Institute on Disability, Independent Living Rehabilitation Research. And with their contribution, they have also helped to support our captioning charges. Thank you. So with that, I am going to turn it over to Dr. Christian Vogler. Thank you.
All right, let me change my screen around here so I can see everything. Just a second. All right, thank you very much. Hello, everyone. So I want to talk about my perspective on how to make communication more accessible amongst people who are interacting. So I research in this area. I've been doing this for over 10 years, and I've learned a lot about how to make accommodations for deaf and hard of hearing people, as well as having some experience with different kinds of disabilities and providing access, deaf, deafblind. But most of my expertise and most of my focus is on the deaf and hard of hearing communities. Next slide, please. Next slide, please. Mike, can you move to the next slide? Great. So I just want to give a visual description about who I am. I'm a white male. I'm getting older and older, so I'm middle-aged now. And I'm wearing a black shirt. And I have this the shirt in there as I'm also wearing a coat. My hair started being dark and now it's starting to get gray. There's more noticeable gray in there. Well, oh well. So I was born deaf and I was raised in Germany. I was the first person who was mainstreamed in schools in Germany. I know a lot about technology. I am kind of a guru. I know a lot about accessibility as well. I am a good professional troublemaker when it comes to making sure that people have access to be able to provide that. If they're not getting that, then I make some trouble. So I'm interested in different ways of accessing both sign. I'm also comfortable with using spoken language. I used hearing aids growing up, and then about 5 years ago, I got a cochlear implant, and about 4 years ago, I got a second one, so I'm bilateral. I am also married to a woman who's deaf, who is from Greece, and we have twins. Next slide, please. So, you know, this picture on the description here is a giant bullet, but this is not, there is no silver bullet for providing access. So you can't just depend on technology alone for providing access. It's not possible to provide full access. It's a process and it's a way of considering and thinking about access and that mindset. So every situation that relates to access is going to be different. So you need to accommodate on an individual basis, which means every time we're thinking about how to provide access, we're going to learn something new. So I haven't talked about technology. You notice that that's not what I'm referring to. And the reason is because when you think about access, 80% is person-based and people doing the right thing. 20% depends on technology. So 20% is an important part, that technology part, but the people need to know how to apply the technology in the right way. Next slide, please. All right. So this is my slide about technology and what it is. It's a tool for allowing people to provide the best access possible compared to other things, so it's important that you have to pick the right tool for the job. Remember I mentioned every situation is unique. So if you have a person who has a good accommodation in one way, it doesn't necessarily mean that it's going to be right for another person. So it depends on the situation. If I'm talking in a classroom or if I'm interacting one-on-one, those are different situations. Next slide, please. So I'm going to start talking about video conferencing. So the picture on the slide you can see here is a Zoom screen. There are 6 people on the screen. So there are some people who are deaf, there are some people who are hearing, and there are some people who are signing, you can see in this picture. So this was, something that happened a lot during COVID, and looking back on that, mostly bad memories looking back on COVID, but COVID, the pandemic, had one big positive that came out of it. And that was to kind of elevate video conferencing as an acceptable way to meet. So prior to COVID, a lot of people struggled with that, with video conferencing. They didn't know how to apply it. They didn't know how to use it properly. Many people didn't know the proper procedures on how to make sure everything was accessible. And so there's a lot of video conferencing platforms that are not really fully accessible. So things have improved greatly over this time. And people are starting to be a lot more aware of how to use video conferencing, mostly. So now we have situations very often where you have a video conference, might be better even than face-to-face because of accessibility access. So for video conferencing, there's a lot of access options. So things that are really embedded in the software itself. So that's one of the huge advantages for that. Whereas in face-to-face, you have to look for some different options maybe and figure out how to make that interaction more accessible. Whereas with video conferencing, there's a lot of things that are already built in. But just a warning that you can't assume that that's going to be something that will work for every individual person. So again, it really depends on, if you're talking about, 10 or 20 deaf people who all sign, that might be better to have a face-to-face meeting in that kind of situation. Because, it's visual, you can manage, wherein if everybody's signing and you're looking at a bunch of different videos, a little harder to manage that, the visual. If you have a small group of people where some people are deaf and some people are hearing and some people are signing, video conferencing is really great for that. It has automatic captioning. You can have chat type, back and forth. And so you can see the screen at the same time. So that can be really beneficial. Okay, next slide, please. So mentioning video conferencing accessibility and how much it's improved, but it's not perfect at this point. So there's a lot of different platforms, and they're not all the same. So you can see the slide here, this graph that compares the different platforms and has different things. So there's Zoom, Microsoft Teams, WebEx, Google Meet, Slack, Adobe Connect, and Discord. So all of them provide video conferencing platforms, but accessibility is focused on, especially for deaf and hard of hearing accessibility for these. So for example, interpreter support, things like that. So we've tested all of these different platforms to see how they work and how well they satisfy the requirements for deaf and hard of hearing accessibility. And so we'll talk about that actually at the NAD conference in Chicago soon. I think that's in July 6th, I believe, is when that conference is, National Association for the Deaf. So this is a little bit of a sneak preview of what I'm going to be talking about at that conference. So we did all of these, there were 61 different categories that we tested out. And some met all of them and some did not. So we noticed that Zoom meets the most at 45. Teams meets 38 of their criteria. Slack only met 9. And Discord had 17, I'm sorry. So it's all over the place. It really is varied. So what this means is if you're considering how to provide video conferencing tools, if you're working in a school or with a doctor's office, it can have a huge impact on your thoughts when you're thinking about which platform to use. And honestly, Zoom is far and away the best of all of these. Not just for deaf and hard of hearing people, but it's really wonderful for people who are blind or have vision access issues, and they can see that that's better there with Zoom. So funny story, the president at Gallaudet University is deaf, and I was having a conference with Apple, and they were using WebEx. And the president was so frustrated at the attempts to try and use the video conferencing. And so once he was done, he yelled at Apple and said, "I refuse to use WebEx in the future. So if you want to meet with me, we have to figure out how to partner and find a better platform to do this." Next slide, please. So if you're thinking about how to pick a video conferencing platform for accessibility, especially from a deaf and hard of hearing perspective, there are some important criteria to think about. So the first thing that you want to do is have automatic captioning and have a good support for sign language interpreters, which means if a deaf person is looking all over the video screen to try and find the interpreter, you want to make it easy for them to be able to see and find the interpreter. You also want to make sure that you have good support for a human captionist and have that embedded into the software. You also have to be able to manage videos in person and pick which videos you're deciding to put up on the screen and pin give people that option, as well as ease of sharing screen. That can be really hard if you have a platform that doesn't allow you to share the screen and all the videos go away and you can't see the interpreter anymore. Another thing that's important to think about is with an informal meeting, if you have a deaf person who needs communication support in sign, some people are calling in through the video, like our video relay service. And so you have to be able to provide a phone number to connect through that. It's also really important to have an ability to do a text chat. And another thing I want to add for people who are blind for screen readers, it's really important to be able to have options to choose for that and an ease for finding that for a screen reader. As well as you have a person, you want to make sure that they can type in chat and have the screen reader as well. And so if that happens, you want to make sure that chat doesn't, interrupt the screen as the screen reader is trying to go through. And a lot of platform management is not great with those. Okay, so next slide, please. So for, medical mental health, we're talking about that. We were talking about video conferencing, but we're also talking about telehealth. So there's a lot of things that actually make me crazy about this. So, you have all these great new accessibilities for all this video conferencing, but telehealth isn't there. There's almost nothing available. So a lot of the platforms do not support offer interpreting services, and they don't support captioning services. So, there's so much room for confusion and miscommunication to happen. So if you want to type something in, if you want to type a message in, a lot of the platforms don't have that option. So what that means is if you're envisioning a world, so if I'm a student and I'm training with a patient, and I'm doing a telehealth meeting, it's really not accessible. It causes problems both for the student as well as for the patient. And so it really is best if you choose a video conferencing platform for those kind of situations. But then again, you have conflicts a lot of times with HIPAA. So yeah, it's something that we can't figure that out. We can't, that's your responsibility to the next generation of people who are working in healthcare to figure out how to make the platforms more accessible. Next slide, please. Okay, so as I mentioned before, accessibility is 80% focused on people and 20% on technology. So you can see if you pick the right video conferencing platform, it's going to make things a lot easier. But you still have to know how to be able to accommodate the person with a video conferencing platform. So it's has a lot of advantage to be aware of what the barriers are that the person experience so that you can work around them. So if you look at me signing and I was listening to the interpreter, there's going to be a delay. Everything will be behind as the interpretation process happens. So if you have some people who are deaf and some people who are hearing in a meeting, and the same thing happens with captioning as well. If you have one person who's speaking, they get done speaking, but the interpretation or the captioning might still continue on for a little while. So if the deaf person wants to jump in and add a comment, they might be too late because the conversation keeps going on, and they're not able to jump in. So the deaf people is kind of watching the interpreter, and then they're too late. And so it requires the presenters to be aware and make sure that there's equal access and opportunity for dialogue to happen. And it makes me crazy that a lot of people just don't see that. So I was in a meeting with a deaf person and everybody else, I'm the only deaf person, everybody else was hearing, and comments were typed. And I missed everything. Yeah, nobody was really paying attention as I was typing in my comments. So people have to be aware and have to be paying attention to, all modes of communication that might happen in a platform. So another thing that can happen often is if you have a deaf person who relies on an interpreter or is relying on the captioning, we have only two eyes and we can't look back and forth all the time. So it's just not possible to take in everything at the same time. So if you're describing something, you want the person to be able to watch. You have to hold on when you're doing a description so they can look at what it is that they need to look at before you start describing it. So give people time to look at the slide or look at what you want them to look at, and then go ahead with your description or what your explanation is. The last thing is microphone quality. A lot of people use really bad microphones. So it can really mess up the hearing, it can mess up with the captioning, and it can have an impact on the interpretation as well. So if you are working with people and you have a lot of distance meetings, make sure, I think probably the number one thing to buy is a good microphone.
Great. So then one of the things I learned that's just immediately beneficial is just training students to make sure to share notes. It doesn't matter if you're in a face-to-face meeting or if you're in an online meeting, regardless, it's really beneficial for them. That way, everyone in the meeting having their laptop or tablet up is able to have a copy of the notes. My slides, you'll see an example, right? I've included a picture of that. So the meeting that we were going to have, we have notes, what we're going to address, summarizing the purpose of it. And then everybody can look and then type on it independently, and then make adjustments, add things as we need to, as we went along in the meeting. And let me tell you, it is one of the best tips to improve accessibility. And that related also well to make sure that everyone's informed. So if you're thinking about patients, doctors need to understand communication, and a lot of it doesn't happen like when they've got, you did, because you didn't see my notes, you didn't understand correctly what was happening here. And so just sharing those notes ahead of time it's a game changer. I've noticed with my students especially. Next slide. Okay, so there are many deaf and hard of hearing people who use assistive technology devices. Assisted listening devices, also known as ALDs. So I have a picture of a bunch of different devices all in one. So there's a microphone, a microphone that you wear around the neck, FM system, right? There's so many different types of technology. There are times where you can have a really powerful microphone in the center of the room. There are microphones that can send a signal directly to a hearing aid or an implant. There are ones that just pick up environmental noise, ones that are good for improving and clarifying spoken language. So there are lots of assisted living devices that can be used. So it's very, very important to be aware of the technology that is present and in some way learn how to use that technology better. All right, next slide. Okay, one thing I want to mention for sure is that people use ALDs in both face-to-face and remote settings. So there's some newer technologies now that we'll transition to, right? So Bluetooth being a big one. Bluetooth's having a lot of technology issues right now. The old equipment also has a lot of issues as well. A lot of old equipment depends upon proximity, right? The wearer has to be close to it, and could be a lot of disconnect, a lot of extra electronic noise. Some old buildings have outdated wiring systems, which adds noise. And for example, if you're using an MRI and there's a magnetic resonance and your office is above an MRI machine, that can mess some things up as well. So a lot of assistive listening devices get messed up. They're not powerful over a distance, and as you get further away, it can mess things up. I've definitely had my own experiences in that situation before. Okay. So it's very important, again, to be aware. What's your environment? Are you in an office? Are you in a room? Make sure that the room is clean in terms of there's no electrical interference. If there's a lot of background noise, move the assisted living device to the appropriate place. Just that simple act of moving it can make a big difference. And again, there are so many different types of technologies so it's important for, to recognize that technology does continue to improve. But all the technologies really are working independently from each other. So there's Aurocast. It's a newer generation of Bluetooth technology. And as that comes out, that's really going to improve the experience. There are new hearing aids available that support that type of Bluetooth technology. But I understand you have to get new users to adopt this new technology as well. So it takes many, many years for this new technology to become more prevalent. It doesn't happen overnight. So it's important to be aware of a few things. First, you might be dealing with old technology, and it might be not interacting well with new technology. But this new technology is going to start entering into the environment right now. So you have to really address the person and what technology they are using and how to make the situation best for them. So really ask the person what they need. Next slide. Okay, another thing I wanted to mention related to video conferencing and auto captioning, but also face-to-face auto captioning options. So on the slide, you see a Gallaudet University professor talking with a teacher, and they're using a phone in their conversation that is displaying captions on the phone. So for example, there's Google Live, a Google product, Live Transcribe. And so I was involved in the developmental process of Live Transcribe with Google at the time. And I'm going to brag a little bit. I'm going to brag a little bit about that work, right? That's been part of that project since 2018. And it's over 1 billion people utilize that, involved in that, who downloaded that product. very popular product. So the production is awesome, and it really, really improves accessibility for face-to-face interactions. There are some limitations that are that's important to be aware of. Next slide. So the first one is only available as an Android product. For Apple, little iPhones, they call theirs live caption, but it is subpar, right? It is not nearly as good as live transfer. There are some third-party apps as well. Otter AI is a very, very popular one. There's also Microsoft Translator and a few others. In my opinion, Android far above offers the best products. There are some people I know who love their iPhone, but they bought an Android so that they can run the captioning app on their Android. It's just great, and at the same time a problem. Next slide. Okay, so a little bit more technology related. Could you understand how the technology impacts confidentiality and privacy? So it's important to be aware that as you run automatic captions, you need to know whether or not they're being sent to a cloud-based server or not. So it depends. For an Apple product, no. So Apple products don't go to the cloud. But their captions are more limited and not as good. And they're only limited to English as the language. Or Google runs captions on the phone for 6 different languages. I think they do English, Spanish, German. I can't remember the other 3 at this time. And so if you're running any other language, it requires the phone to be able to communicate with the cloud. So that's an important part of accessibility purposes, but it does impact privacy and security, but also leads to a better experience. So the captions are running on the phone only. They can run on the phone only and not connect to the cloud. But so for more privacy and more security, turn that feature off. So important, people need to be aware of that. But unfortunately, it's not HIPAA compliant. So I think the best thing to do is, if you have a patient or a student who brings their own device, just make sure to have a conversation so that they're aware of the limitations. And they also have to be aware of privacy, security, and confidentiality, and then better to turn off any cloud network connectivity so that it runs only on the device, which allows people then to make that choice for themselves. Okay, next slide. One last thing related to automatic captioning I want to mention, because again, 80% of accessibility is about people. Only 20% of accessibility is going to be dependent on the technology. So, for example, if a person brings their own device and they have automatic captioning on it that they can use, then great, go ahead. But don't assume it's going to be successful. You need to have eyes on the device and look at the captions that are being produced. Are the captions actually following what you're saying? Because if you notice that there are a lot of mistakes, best to go back and correct those mistakes as you see them. So again, don't just assume that the person's going to be aware that what's on the live captioning is a mistake. And if you're with a person who's deaf or hard of hearing who's using caption, make sure that you are also part of the actively identifying mistakes and correcting them as they pop up. Another important thing to mention is, again, a person only has two eyes. They can't look in more than one place at the same time. So if a person's using captioning and they're watching their phone to see what you're saying, you have to be aware that if you want them to look at something else, they can't look at the captions and something else at the same time. Oh, I can't tell you how many times I've experienced that where I'm reading the caption and the person says, but I want you to look over here. And I go, yes, I understand that, but I need to see what you want me to look at. And then I can look at what you want me to look at. And then I can go back to see what you're saying. All right, next slide.
All right, so to summarize, so this picture here is people have different colored skin and they're all holding wrists. And that everybody is different. There is no one size that fits all. So all of you, each of you are important in making sure that accessibility happens for people. So we all need to continue to assess situations and recognize what needs to happen and what works and what doesn't work, and think about how to fix the things that don't work. Never stop. You can't just sit and say, oh, we don't really need to think about accessibility. You always have to look at each situation and make sure that everybody there is getting equal access. And last thing that I can't emphasize enough, one of the biggest problems in the medical field is that there's so much of a power imbalance. So it's very important that we all have to make sure that we work with individuals and ask them directly about what their needs are, what works for them. You can't just make an assumption on what the right thing is. So I think in the last slide is my contact information. And then that's it. And I'm going to turn it back over to Mike.
All right, thank you, Dr. Vogler. I really appreciate it. So this is Mike McKee here speaking. So I'm going to just pivot a bit over to the healthcare side and just kind of really borrow some of what Dr. Vogler already mentioned. And there's a lot that we can adopt. And we need to do better to improve the accessibility of our patients, especially those with sensory disabilities. So I'm going to move on to the next slide here. So why is it important to really kind of learn from Dr. Vogler all these strategies and really trying to get their feedback on how to make this accessible? We need to adopt that same approach in a healthcare setting. Communication breakdowns are not trivial. They impact the quality of the visit. They impact the satisfaction of patients. They also affect the satisfaction of providers too. So we need to understand when you break down on the communication because we don't provide access, that's going to affect not only their quality of the visit, but it's going to affect their health. And many of these patients, unfortunately, will not adhere to your recommendations. If they don't understand what you're trying to say, why would they follow recommendations? Many of these people, we have already seen evidence, will be more likely to go to the hospital and the emergency department. When this breakdown occurs, we're also eroding their opportunity to learn about health information. Patients consistently, regardless if you're one with a disability or one without a disability, have always consistently said, my doctor is the most reliable source of information. When that access is broken down, you have taken that most reliable source of information out. And obviously, we need to recognize that this is a civil rights violation. We are violating the laws, and we'll show you in a second the different laws that apply. When we don't apply or accommodate their needs, whether in providing an interpreter or even their request for captioning services, or even large print for any health information, having captioning on videos that are going to be based on the health information you share, And this all, again, goes back to our lack of awareness, lack of provider training, staff training. We need to incorporate and make sure that we teach our next generation of the workforce to know how to do this. Part of what we're trying to do here in MDisability is to have this next generation of interns, students that go into healthcare who will make a change and impact all of these areas. Dr. Vogler is talking about a lot of these access tips that will make it easier for students, interns, residents, trainees who may have a disability to actually be successful in the healthcare environment. So briefly, just talk about some of the disability laws. The first one was the Rehab Act section in Section 504. That applied to public sectors, did not apply to private sectors. That was not until 1990. This was a landmark law. I remember vividly 1990 when it passed. This actually now prohibited discrimination even in the private sector. That was a big gap for many of us. But what many people don't recognize is that the Affordable Care Act, especially Section 1557, is very powerful and also strengthens and prohibits discrimination on the basis of disability, among other stuff, such as race, ethnicity, and so on. There are several components of the Section 1557 and also additional sections that, again, emphasize the importance of inclusion and accessibility. So I want to just really emphasize one thing. Healthcare inaccessibility and inequity is a form of social injustice. We just need to really put that out there. We need to change that. We need to just recognize that every time we don't accommodate or we do not provide access, we are failing our patient population. So are there strategies to address that in addition to what Dr. Vogler mentioned? I do believe we have several strategies that could be easily adopted. So first of all, disability screeners, I think, could be a very powerful tool to address some of this social injustice that is occurring. So first of all, in our EPIC system, which is the largest electronic medical record system supplier in the United States, we have modified and we have incorporated a tab that's called the disability accommodation. This was actually the fruit of many people getting involved here in Michigan Medicine, Center for Disability Health and Wellness, and Disability, and also the Council for Disability Concerns, was able to work on this and make this go live a few years ago. And this actually now can capture patients. Do you have a disability? And if they do, what type of disability they have, what type of accommodations they require. This actually makes us to be aware of the care needs, the accommodations they require to make that visit more accessible. This is, again, trying to make us more proactive instead of reactive when we manage the care needs for many of our patients with disabilities. You would hate to show up in an appointment, see this patient, nothing is in place, and the visit is going to be of poor quality. When you have this information early on, you can actually think about what might be needed in advance of the appointment. So just briefly, a lot of people push back and say, well, I don't want to know that information because I'm not sure if I can accommodate it. Again, it's a medical legal mandate that we need to meet their needs. We need to make sure we provide the access that they deserve. In this brief study that we did, it's a brief report that's now published. We gathered responses from 514 patients in the primary care setting. And we asked just to get a sense of how many people self-report having a disability, and 13% said, I have a disability. And more than half of them said, I do need to have accommodations, and they listed types of accommodations. My point here is that 13% is not a trivial number. This is actually a pretty significant component of who we see every day in the clinic. And many of them do require some accommodation to the visit to make that visit more accessible. On the next point that I also want to emphasize, some of these accommodations are very easy to implement. Many of them are not difficult to do, and that also pushes back on the argument that I hear from many doctors. I just can't manage it. I can't implement it. And the reality is that that is not necessarily true. And some of the examples were even just implementing assistive listening devices. Dr. Vogler mentioned several. I'm actually using one with the mini mic. with this to help with some listening support. The inclusion of support person in appointments, assistance with transfers, and also the use of a transparent mask. Luckily, technology is increasing. COVID, in my opinion, I know was very disruptive to our lives, but it was also an opportunity to really disrupt what we traditionally did in medicine, to really think about how we want to make things more accessible. So the first thing is transparent mask. We continue to advocate, make sure that people are aware of these transparent masks. I do want to just really highlight safe and clear is FDA approved to use in our healthcare setting, especially in the clinical side. We do have another one that got FDA emergency use approval with clear mask. Unfortunately, I heard that they might not be in existence in the future. Hopefully that's not the case. But there are several manufacturers with transparent mask, and I encourage to have these available in your clinic. When you're developing health information online, creating videos to teach our patients, and you want to share them, please check and see if they're accessible. Do you have captioning? We have easy ways now that are free where you could go into YouTube, be able to set up and have what we call a beta captioning, AI-led captioning to do a first run through to kind of fill in the captioning, and then you can modify and edit as needed. This actually saves a fair amount of time. It also, if you feel like you do not want to go through this, another opportunity is to outsource it to companies. One company a lot of people talk about is REV, and generally that's a charge about $1.50 per minute for the captioning of these videos. So obviously before COVID, we did not have anybody receive captioning in our clinic appointments. That changed when COVID hit, and we now have that available, especially for our hard of hearing, to be able to have captioning, especially engaging with our providers and staff. That's unique. Again, another example of disruption because of COVID. I personally use Otter AI. I'm an iPhone user, and so, but like Dr. Vogler has already mentioned, there are several AI-led captioning tools that will continue to expand. We heard 1 billion people using it, and so we're going to expect more and more people use it. The quality is only getting better, and this is actually going to make our lives easier in terms of getting accessible information. In this case, on this video, this picture here, we have a picture of a gentleman looking at an iPad, basically looking at the captioning. And this is available for, upon request, to set up in our appointments. So again, when we talk about accessible information, we need to recognize how hard it is for deaf, hard of hearing, deaf-blind, those with low vision, to be able to access information. It's not equal like what we see in the general population. We miss out on a lot of what we call incidental learning opportunities. You can imagine if we're having a dinner table conversation, or you're at the water cooler at the workplace, people chit-chatting, we miss out on those conversations. Many people will say that's not really important, but the reality is that they are critically important to build on, and it's almost like a scaffold, and builds on information. For example, in a dinner table conversation, if you have a family member that says, oh yeah, you know, my uncle is so struggling with bad eating habits, now has heart disease. You don't get that information. How are you going to share that with your primary care doctor or your family medicine doctor to know about the family history? You also learn about bad eating habits sometimes can increase the risk for heart disease. So again, incidental learning opportunities are incredibly valuable, and many people with sensory disabilities miss out on them. Same thing for schools. We have low expectation. We often don't give them the same level of health training, education in the schools. Same thing with work, family, friends, media, online information. Many of them don't incorporate and think about accessibility, and it needs to be a major checklist, check them off to make sure that we have made sure that the information is inclusive. Dr. Vogler and I are part of a grant that's focused on trying to improve the online health information for people with sensory disabilities. I'm working with Dr. Tyler James on this, and this is a grant through the National Library of Medicine. So hopefully we'll have much more information in the future to share. I want to just briefly mention that sometimes I hear a lot of pushback by health literacy experts saying, well, just think about plain language or just have some key principles that will generally do a good job in addressing access. The key point here is that it's not a replacement for ensuring that you have your access set up, making sure accommodations are provided. And I will mention this briefly. I had a deaf lady who I saw for the first time. She was taking a cholesterol-lowering medication, which many of them you cannot take grapefruit or grapefruit juice. She told me, I make sure I drink grapefruit juice every day. And I said, oh, why are you? And she emphasized it, why are you doing that? And she said, it was in my pamphlet, it was bolded. And when we realized is that bolded, it was do not drink or eat grapefruit or grapefruit juice. English was not her preferred language. It was American Sign Language. And the reality is that she saw bolded, she saw the word grapefruit when she buys in the food stores grapefruit. She did not understand that do not consume with this medication. So that's an example. If you don't provide access or meet their language needs, you're not going to be able to address all of the concerns just by doing plain language or incorporating health literacy principles. They are important. They need to be part of the picture, but they are not the entire picture. When we do our Deaf Health Talks or many of our videos, as you can see here today, if we have, we need to be mindful of accommodations. We need to have interpreters in place. We need to also have captioning set. That does take work. And we are very fortunate here. We have Dawn, Liz helping us as well. And so we need to be intentional. When you have requests, make sure that you are meeting the needs. Dr. Vogler has mentioned again and again, ask them, is this working out? And if it's not, you need to modify it. So it takes work, but this actually will make it beneficial for everybody. So I'm going to just briefly talk about some strategies, and I want to just pause, give some time for questions and answers. So in this one, we have a picture of a doctor looking at a patient. And again, eye contact, that engagement is really critical to be able to see. And it also builds that rapport that we need as well. You can also get cues, know that they don't understand you, to be able to modify, maybe say the statement differently. The other picture here, we have an accessibility checklist. We ask patients to ask, basically do a review. Where are your concerns? Where are things confusing? Where are things breaking down? And that way we can have that information and hopefully address them. In the bottom, there are some other strategies that we do with deaf and also hard of hearing patients, where we use there's a picture of a Ubi Duo two-way typewriter. So that helps to facilitate very brief conversations. So a staff might say, I need your insurance card. This is not a replacement for communication between a provider and a patient. Again, assistive listening devices. You saw several products that Dr. Vogler mentioned. We actually have one, and they're not expensive at all. Very, very helpful for hard of hearing English speakers. Keep in mind, many of them cannot afford hearing aids. And when they can't understand you, this can be a valuable tool, especially for those with moderate hearing loss. And again, virtual visits, we heard some of them are not HIPAA compliant. We here use Zoom Health, which is a secure HIPAA compliant Zoom platform. It does allow what we call three-way or multi-way video visits. That's very important because you want to include, in cases of like an interpreter or captioning, you need to be able to have opportunities to include others. But what we found is that by being more inclusive, we also improve the ability to include our medical students, educate them while they can join that visit, or we can also have their legal guardian, or we can have other members of the family. So when we start to think about making things more inclusive, universal design, we end up making things better for everybody. So I want to briefly also talk about some blind low vision patients, some common accommodations. So we do have some blind patients, low vision patients in our group. Some of them are also deaf blind. And what we, whoops, sorry. So what we do is actually, let me go back. So we have audio descriptors. There are some videos that actually have audio descriptors. I have a funny story. My very first experience with this was before I had my cochlear implant. I had a final course in college in which I was actually doing Godfather as part of my college report. And it was a history of film. And so that course, I ended up showing a video from the library, and it was the last one available. I did not pay attention that it also had audio descriptors. So I didn't realize that people were saying there's another voice. And I said, no, but that's because it's part of the video. Those are the actors. But the reality is that having these audio can help describe what's being displayed, how the actors are acting, what their emotions look like. And they insert it in between statements. Really very helpful to have more inclusive and with the audience as well. And then the other thing is it's popping up here, the alternate document formats. I'm sorry. So this one actually, we can look at, for example, large print, which is part of our EPIC system. And that is available to generate usually about a size 24. If we want it bigger, I will copy and paste and put it in a Word document and make it even larger font. That's really helpful. You heard Dr. Vogler talk about live notes. When I wrap up a visit, I always talk about summary, key points to talk about. And again, in a print format, so everybody, we can make sure it also reaffirms what has been shared, confirm if there's any errors. And so I would encourage you to think about that in terms of your strategy wrapping up with the patient. And then briefly, before we stop, the human guide technique is another one, trying to navigate the hospital clinics. We have Dr. Tyler James has a HOPE. He's been working with the HOPE ambassadors here in Michigan Medicine. And we actually have free videos and training that we could share if anybody's interested. So I'm going to have this available to share, but I'm going to stop here so we can have opportunities for questions and answers. So first question, it's good to, Gretchen, hello again, good to see you. So thank you for your question. And in terms of the use of auto captioning, this is through an iPad to a patient through appointment. Is it auto caption and what kind of platform is used? So it depends. Most of our virtual business that we use are auto caption with Otter AI, which is the AI-like captioning that built in Zoom. And I will also just raise a caveat that there may be some errors with that. So when we turn it on, I usually will go through. Dr. Vogler also mentioned to kind of proofread it to make sure that there's no errors. It's actually pretty reliable. It works well for many of us. But again, the provider needs to see it just like the patient. So that's important just to make sure for transparency. Now, we do have people that say, I prefer to have a remote captionist, and we can also insert that. And like I said, the technology is improving, and I think this makes it easier to implement for all of us. So you don't have to worry about scheduling. It can actually be turned on. Okay, I'm going to go back and try to share the resource guides. Yes, I would do that. Okay. CB also mentioned a really kind of important point. So when we have the clear mask, that actually can make it sort of soften the sounds. Also somewhat similar to a regular mask, but we have noticed that a little more of an impact as well. And so just be aware that you may have to talk a little bit louder. And again, just think about for the viewing as well. Okay, so what do you do if there's a disagreement in what was discussed in the patient notes with the doctor? One of my first printed patient summary was only the doctor perspectives, and my concerns were pretty dismissed. So again, I think one of the key things is have at the end of the visit to do a summary. So, okay, we're going to do some lab work. We're going to do this is going to be a new medication we're going to start. We're also going to just really watch your symptoms, see how you are. These are potential side effects. And then having that in an after visit summary. I think helps to mitigate some of those discrepancies that may happen, that may pop up. So I think this is a good point. What tends to happen is that there's no summary, there's no teach back or teach to goal, and here's the information. And like, whoa, this is not what I remember seeing or hearing. And so I think having some sort of a recap before you both leave is really valuable before you get that after visit summary. So that would be one strategy. Obviously, if there's a disagreement, I would encourage you, many of us have access to the provider notes. If you don't agree, let them know and try to get those corrected because you don't want that to go into permanent record. Insurance may think you have a health problem when you don't. So I think it's a great point.
Anything else you want to add, Dr.? Nope, I'm good. Thank you.
Okay. All right. Thank you, everybody. And feel free to contact either one of us if you have more questions. Okay. And bye.
Thank you, everyone. Bye-bye.